Assemblymember Harbidian, please come forward with AB 1642 relating to wildfires.
Thank you, Mr. Chair. I've talked to all of you about this bill. Bills are like children. You never want to pick your favorite, but I'm not sure I have a more important bill that I've ever run or that I will run. And that's because of what our community has gone through with the Eden fire. Many residents have gone through a lot trying to get back into their homes. And what we're finding out is during that struggle and through that struggle, folks are being forced to move back into homes with serious smoke damage where post-remediation, there's still high levels of contaminants, lead, ash, and other contaminants that you'll find in urban wildfire. And the issue is and what's become painfully clear is that there are no scientific standards in the state of California, despite the many urban wildfires that we've seen, to determine what is safe.
My name is François Tissot. I'm a professor of geochemistry at Caltech, where my research group uses specialized instruments to measure the concentration of elements in samples. I'm also an Eaton fire survivor. After the fire, I found very little information to assess the risk of returning to potentially contaminated homes. My lab and I therefore started working on this problem. We have studied the composition of dust found inside homes and structures. We have measured the concentration of most metals, including lead. Our results reveal high levels of heavy metals, particularly lead, in the dust collected in standing homes in Altadena, but also much further than expected, several miles downwind of the burn area.
My name is Jane Lawton-Potel. I am a founder and executive director of Eaton Fire Residents United. We're here on behalf of thousands of residents whose homes are still standing, but are full of dangerous, poisonous contaminants left over from the fire. One of our neighbors, Billy Malone, saved his home just yards away from the burn scar, but it suffered severe smoke damage. Billy had a remediation company come to his home to do cleanup and followed up with testing. After finding lead, the remediation company returned and did another round of cleanup. But once again, after testing, they found lead. Billy's wife, Nina, is disabled, and the smoke and debris in their home is making her illness worse. But instead of ensuring remediation was completed successfully, his insurance company says they're done paying for anything. Now Billy and Nina are trying to clean their home by themselves while living there and ingesting contaminants every day. We've heard countless stories just like Billy and Nina. Families are being financially forced back into homes that have never been properly tested or remediated. Children are sleeping in rooms that have not been cleared. Insurance carriers stall on approving testing and cleanup, while temporary housing coverage quietly depletes. By the time families need it most, it is all gone. And by then, we have nowhere else to go. Without a standard for when it's safe to return to a home covered in WUI fire ash, every home safety assessment is a negotiation, not a scientific determination. That is why our core campaign is clearance before occupancy. A home must be tested and cleared before any family is required to return to it. We were promised we would be able to return home safely. AB 1642 is the best way to do that. Thank you.
Thank you. Any additional witnesses in support?
Stone advocacy on behalf of Consumer Watchdog in enthusiastic support.
Hi, Dawn Fanning. I'm with Eaton Fire Residents United, and I'm here on behalf of over 80 organizations, over 600 individuals, signed on to this. I'm specifically Churla, Endalon, I can't even read because of my tears, Public Council, End Child Poverty of California, Indivisible, Natural Resource Defense Council, NRDC, and Physicians for Social Responsibility. So thank you. We urge an aye.
Hi, everyone. Cleo Bluthenthal with the California Community Foundation and strong support.
Do we have any opposition to the bill?
Good afternoon, Chair, members of the committee. I'm Allison Adey on behalf of the Personal Insurance Federation of California. We're here today in respectful opposition to 1642 by Assemblymember Harbidian based on the March 2nd amendments. Over the last 2 months, we've been having conversations with the author and his team about soil and debris removal post-disaster and existing gaps in the data necessary to respond to the complicated issue of smoke claims. These components of the bill we are very, very much in support of. However, the recent amendments have substantially expanded the scope of the bill to delve into claims handling requirements in a way that curtails ongoing discussions with the Department of Insurance, establishes broad requirements that are not necessary in every situation, and will result in billions of dollars of additional claims expenses, exacerbating the current insurance crisis of both availability and affordability.
Mark Segnan with the American Property Casualty Insurance Association, also in respectful opposition. The insurance industry supports science-based, uniform statewide standards to reduce inconsistencies. These standards can also protect wildfire survivors from scare tactics used by opportunists who assert the existence of rare chemicals that are actually not present. The July 2027 deadline may be unrealistic given the lack of existing standards and peer-reviewed science on the health impacts of toxic chemicals for all but a small number of compounds in residential settings. There are significant gaps in scientific research, which takes years of carefully planned study to properly evaluate and document. New standards must balance public health protection with practical feasibility, ensuring access to qualified environmental professionals. Standards should also reflect meaningful differences between homes, schools, and workplaces, acknowledging varied exposure pathways and regulatory frameworks. Collaboration across local, state, and federal agencies, including the Department of Insurance, will help avoid conflicts of duplicative requirements. The industry seeks cost-effective, validated testing methodologies to avoid unnecessary or unproven procedures that drive up recovery costs.
Thanks. Coming back to committee members.
I'm frankly excited to support this bill today, Assembly member. As everybody here knows, I live in a very similar wildland-urban interface to your community. And we mostly have been put onto the FAIR plan. So insurance availability isn't a thing for me yet, but hopefully one day it will be. In the meantime, I think what is really critical is when people are paying these insurance premiums month after month, that when something like this happens, the insurance companies do right by the families. And I think the people best able to determine what is safe isn't the Department of Insurance, frankly. It is the scientists at DTSC. But I think it's important that, as the author clarified, that the vision of this is that the Department of Insurance will continue to oversee availability, affordability, all the things you are concerned about, but that we will have real scientists determining when it is safe for a family to move back into their home, because that is what everybody on this committee wants. I can say with certainty is that we all want families to be safe and healthy and living in California in the way that they want. And the tragedy that you and your neighbors went through, and then having to fight to get homes that are safe for children and seniors and people who have illnesses, should not be what you're going through. You made a deal with a company that you would pay them month in and month out, and when this happened, they would ensure that you had a safe and livable home. And we, as your representatives, have an obligation to make that real. And I think this is a huge step in making that real. And I know that if I were moving back into a home after a fire, and I live in a very similar jurisdiction, I would want to know my babies are safe. I hope we can make that happen for you.
Assembly member.
Yes, I'd like to also thank the author for all of the work you've done in that area. We're talking about Eaton, and as we know, it's one of the largest communities of African Americans that been there for decades. And I have a lot of friends that live in that area. I've always been concerned about the rush to build. And I know that the community also wanted the rush to build. You know, we heard a lot about we're not doing enough to rebuild, but I've always been worried about the soil and the contamination, and was it being done correctly? And if not, people are gonna suffer from it. We won't know for 10, 20 years, you know, whether it worked or not. So I am going to support this bill today because I believe that the scientists should tell us yes or no if it's safe. I really do worry about the safety of my friends and family up there. And so I thank you for this bill. Thank you.
Any other questions or comments from the dais? Seeing none, I have a couple in a minute, but I'll invite the author to close.
I respectfully ask for an aye vote. Thank you.
Thank you. So this does have a aye reco from the chair. I want to thank you for bringing forward this important bill. Obviously, huge impacts on your district, as was so well stated. but really statewide. So appreciate your work on this. It does sound like there's broad agreement that we need standards to ensure that people can safely return to their communities. So we really do appreciate your push that these standards have to be health protective and based on science. Let's go ahead and call the roll.
This is file item number 2, AB 1642, authored by Assemblymember Harabedian. The motion is due pass to the Committee on Appropriations. Connolly?
Aye.
Connolly, aye. Ellis? Ellis not voting. Bauer-Cahan? Aye. Bauer-Cahan, aye. Castillo? Not voting. Lee?
Aye.
Lee, aye. McKinner? Aye. McKinner, aye. Happen? Aye. Happen, aye.
5-2 vote, that matter passes. Thank you.